right, welcome back to Body Beautiful. I'm Janelle Marie. With us today, we have plastic surgeon Dr. Joseph Mele. We are talking about a bunch of different topics. Remember, any advice we give you today on the show, consult with your physician first. All right, let's talk about tummy tucks. Always a popular one. Mommy makeovers, tummy tucks, all that good stuff. So what is the tummy tuck fix? Who needs one? So
tummy tucks are a way to tighten up the abdomen, so tighten up the abdominal wall. And it works not just on the skin, but it works on the muscle. And it also helps if there's sort of a smaller amount of fat in the lower part of the abdomen.
Oh.
If someone's really overweight, it's not a great operation.
Okay.
Because after a while, we start putting fat inside, behind the muscle, where a tummy tuck can't fix it. It's kind of like trying to shed a suitcase that's too full.
Oh, I gotcha.
But if someone's near their ideal body weight, or all their fat is outside and low, that goes away with the skin that's removed. So it works very well.
How long does the procedure take?
Procedure takes, again, an hour to 4 or 5 hours sometimes for the bigger, massive weight loss bariatric patients. And most of the time is spent just trying to make it pretty, trying to get the incision smooth, get it low enough so it's hidden, and reinforce it internally so it's not as likely to spread or give us a bad scar.
So when you say reinforce, you're actually talking about, you know, cutting the muscles and sewing them back together, get them nice and taut?
The muscles I don't actually cut.
Oh, you don't?
I
that's
imbricate them. That's our fancy word for folding them over and tightening it up. So again, it's like making a corset inside.
Oh, nice.
So outside of the muscle, there's a very tough layer called fascia. And fascia is kind of like the skin on the sausage, but it's much, much harder. At the ends of the muscles, it's what becomes the tendons. So it's very, very hard. So we can put stitches into that fascia and not into the soft, squishy muscle and bring everything together. So if you move the case over, the muscle comes with it.
So you kind of get a nice waist in there also. You get your waist back, maybe after you have children. And
well, if you look at a lot of the before and after pictures from the front on tummy tucks, you'll see the shadow from the edge of the rectus moved in afterwards.
That's great.
And people, some of my folks are really in good shape before, but they've had children, or they were heavier before, and the muscle gets stretched out, that fascia gets loose. By tightening that up, now you can see what good shape they're in.
There's tummy tucks, and you also mentioned mini tummy tucks. So is the scar different in that? Is it, you know, only some people need the mini tummy tucks? You know,
the scar is different only because the patients are different. So a mini tummy tuck is someone who, if you cover it up from belly button down, their belly looks great already. There's really no reason to touch it. So with the mini, we can tighten the muscle below the belly button. We can remove a small amount of skin, about half the skin between the belly button and the pubis, and recontour that fat. The problem with the mini tummy tuck is if there's anything going on above, or if someone gains weight, that fat tends to come back in that area.
In the upper area?
In the lower area. Because the mini are only taking half that lower stuff away.
I gotcha.
Whereas with the full tummy tuck, taking away where the fat goes first, all of it where the fat goes first. So if someone gains weight, it tends not to preferentially fill that area.
Can women have children after a tummy tuck? Or?
They can, but it's better to wait. There's nothing about the tummy tuck that's going to prevent someone from having a kid or becoming pregnant, but it will stretch that area out again, and then we may end up wanting to do another tummy tuck.
What about men in tummy tucks? Do a lot of men coming in asking for that?
I do tummy tucks for men, but it's much more difficult for men because unless they've gained a lot of weight and lost it, it's a different problem. Men, a lot of times they'll come in, and we've all seen guys with big round bellies that are hard as a rock.
Oh, I see.
Because there's very little fat outside of the muscle.
I gotcha.
So if all the fat's inside,
you
just can't tighten against that.
Gotcha.
So sorry, guys. It's more work for you sometimes.
But they can get liposuction.
Well, that lipo, too, only works on that outer area. So, yeah, that core fat, which is unhealthy fat, we should lose it anyway, is also a problem with plastic surgery.
What's recovery time for a tummy?
Tummy tuck, a couple weeks. I think most people, the first couple days, really sore. It's kind of hard to get up from sitting or laying down. Most patients, once they're up, they feel pretty good. By the end of the week, feeling better. By 2 weeks, kind of back to doing most of the normal stuff they do. But I don't want people doing, like, kickboxing 2 weeks after. So about 6 weeks, everything's totally solid, and you can do whatever you want.
And the scar tends to fade over time so that it's pretty much gone.
It takes a year.
Takes a year to really fade it?
But there are things we do afterwards, both in surgery and after surgery, to help make the scar smaller.
Okay.
So both topical silicones, sheeting, and just massage. Vaseline actually works pretty well for scars.
It does. To flatten it out and just kind of make it nicer.
To help it keep from getting as red and help it heal better, faster.
That's a good idea. You know, I always wanted to ask you about the body lift, because we're talking about tummy tucks, and a lot of women have the saggy thighs also. Can a body lift help with all that kind of stuff, or what is essentially a body lift?
A body lift is essentially a tummy tuck that goes all the way around.
Okay.
So it lifts the buttocks. It gets rid of the soft, loose skin at the lower part of the back. The thigh, the lateral thigh is helped with a body lift. The inner thigh requires a thigh lift, which is an incision that goes down between the legs in order to lift that inner thigh skin.
Oh, okay.
So a little bit different. I can't quite get all that up. But it's not uncommon with someone who loses a lot of weight to do a tummy tuck and then also do the thigh lift at the same time in order to get everything so it matches. Especially
if you do the stomach.
Yeah, so the stomach looks a lot better. I don't want them now worried about the next area. Yeah. Keeping things in proportion is really important to what I do.
Sounds good. All right, if you want more information about Dr. Mele, you can call 925-943-6353 or check him out on the web, either drmele.com or sanfranciscobreast.com. Remember, you can see all the before and after pictures at drmele.com. We'll be right back on Body Beautiful. Stay tuned.